Good afternoon.
Hi, how are you?
Hi, good. This is Melissa Purley, and I'm here with Y Wool on for the Vermont Sheep and Goat Association, and we're here visiting this afternoon with Elizabeth Martens from Valleywide Vet in Bridport. And thank you for being with us this afternoon.
Great.
So I don't know if you know what we've been doing, but we've been trying to do, our podcast is Y Wool, and the idea being the focus on why someone might want to get into breeding sheep and being part of the wool process in our area. And so what we're trying to do is hit various kind of topics that are educational. Mm-hmm. And we thought that sitting down with a vet would be a great idea.
Sounds good.
So Kelly Oddie, who is here with me doing the background stuff, you are her vet.
Exactly.
So here we are.
Yep.
Again, thank you. So I guess I had a few questions that you and I have talked about, and I wanted to know what inspired you to be a vet. I did some reading about you and that you grew up on a farm in the Finger Lakes.
That's right.
True?
Yeah, so definitely growing up on the farm. We had all sorts of different animals. We did have sheep when I was little, but mostly I gravitated towards the cows. My uncles had a dairy, and I had heifers. We had pigs and chickens and all the rest. And then as young as I think 13, I started riding along with our local large animal vet, which seems crazy to me now that I was 13, but I just got to see so many cool things. And then I kept an open mind through college, and then after I graduated and I went into the Peace Corps for a couple of years, I decided that vet school was what I really wanted to do.
Mm-hmm. And so when you were 13 years old and riding, did you get like a job? Did the vet come to say to you, "Can you hand me this?" And "Can you do this?"
Definitely. Yeah, a lot of learning how calls went and just learning where things were on the truck. I could go get things or help clean up, or I'm sure I wasn't that much help, but helping to carry things.
Right.
Yeah.
You probably think to yourself now, I'd like to have a 13-year-old ride
sometimes.
Exactly. So Valleywide is primarily dairy, is that correct?
Yes, we mostly see dairies, just being Addison County, full of dairy cows.
Right. And so how many vets are in this practice?
Right now we're 5 vets.
5 vets. Mm-hmm. And you divide things by area, or how do you determine, or is it by call, or how do you determine who goes out where? And
yeah, so for the larger dairies, we usually have them on a schedule where we're there once a week or every other week. And so each herd will have either 1 vet or 2 vets that primarily go there. And then as emergencies come in, or other things, or smaller places that don't necessarily have a dedicated vet, it just gets divvied up by Kim, our front staff, knows who should go where and when and where things are located. But it depends on where things are and who can get there.
So I have a question. So I know that when I take, it's not the same with my sheep, but when I take my dogs to the vet, they know where they are, they know who they're seeing. So my question to you is, when you go to, if you're seeing a barn, every week, do you feel like, do cattle, is there a recognition? Are they, here she is again?
That's a good question. The cattle that we work with are rarely terribly nervous around us, so I think they're used to the handling aspect. And even if I'm not doing anything with the cattle, I'm walking through. So yeah, they seem pretty comfortable with us being there. And if they're caught up for some reason, maybe they're a little more anxious. Something might happen. But I think they probably get used to our presence.
I think so too. Yeah. So I would ask, what kind of veterinary medicine would you say is your specialty?
Well, here we see 2-toed animals, so sheep, goats, cows, and the occasional pig. I'll also see chickens if people are interested, if they have backyard chickens or something. I've always had chickens, so there's only so much we can do on a herd level basis, but absolutely, and I think it's important that we're kind of out there and involved if people have questions about chicken health. But yes, mostly cows, and within that, I speak Spanish, so I do a lot of employee training. So that comes down to milking and calf health and maternity health, so giving birth and taking care of the newborns.
Yeah, I read about what you did. So in the Peace Corps, it seemed like you did some amazing projects, the library and different things like that. But then also, I thought it was really great what you're doing now. Can you tell me a little bit more about what you're doing with the Hispanic community and on-site training and the things that you do?
Yeah. Well, it just depends on what the farms need. It seems like every week, almost every day, I speak Spanish to somebody somewhere.
Really?
If that's just asking where the cow is, what's been going on in her history, health-wise. Some farms may be struggling more with milk quality or with training new employees on how they want the milking procedure done or calves fed or how they want to be notified about a sick animal or something. I'll just translate in the moment. But I also do more formal trainings that I have prepared, that the farmer doesn't necessarily have to be there prepared themselves. They just let me know that we need X, Y, and Z trained on, like how to intervene with a calving that might not be going normally, what is normal, what's abnormal, basic health problems that they can treat themselves, stuff like that.
Yeah. So you enjoy the opportunity to speak Spanish?
Oh, absolutely. Yeah, it's great.
And that's a really nice kind of diversity from what you do just going out onto the farm. I would imagine that would make your job interesting.
Interesting, exactly. Yeah.
I think so. Yeah. So I was saying, in working toward educating people who are new in farming, and what you're saying is that's quite a few people that you deal with. I guess I think educating people is when to call a vet in, because you go to extremes. We have people who will say to us, as for us at small farming, who will say, I never call the vet in. I always take care of it myself, and if I can't find the answer, we know the answer, right? And yet there are other people who have a very different philosophy on taking care of their animals. So I think in a generalized way, it would be helpful to people to know, when should we call the vet in? When should we try to take care of it ourselves? Because you probably have people who call for things that they could have taken care of themselves.
Absolutely. Yeah.
So when should we call the vet?
Oh, that's a really hard question, and I think it depends a lot on the individual and their comfort level of trying things. If it's a very large herd, some of these, like maybe more meat processing, hundreds and hundreds of sheep, and they lose a couple here and there, that's pretty normal. Less than 1 or 2% death loss is very normal. But if it's an individual, maybe you've only got 10 animals and one is very special to you, then call sooner than later. I think most vets are very open to just chatting about something, as long as you're respectful of our time, 5 or 10 minutes about a case. Here's what you can do, here's what you might see, and then let's follow up in a couple days. That's reasonable. Any neurologic case, which is an animal that's acting drunk or like unsteady on its feet, or maybe blind or something like that, call sooner than later. Absolutely. Could be something like polio, which in animals is a lack of the thiamine B vitamin, which we can treat, but it could also be something like rabies that we want to make sure we identify right away and make sure people don't get exposed. What else?
So the parameter would be something that is very unusual in our own animal. What about things we've had so much rain and water, right? So everybody I know is like hoof, all the hoof stuff. What about that in calling vets in?
Yeah, so
I'm listening carefully here.
We have so much foot rot. Everyone has been seeing foot rot, and if that's something that you've seen enough of that you can identify, it's a very distinct smell. So you smell it once, you'll probably pick up on it. You can absolutely treat that with a foot bath to start with. A zinc sulfate foot bath is curative in a lot of cases, especially early on. So nothing that the vet would need to do. Antibiotics work on individuals well as also. Some people talk about treating the entire herd or flock with an antibiotic, something usually called Zactran, which is quite expensive, and it's excellent in some cases if your idea is to eradicate it from your flock. But that's a conversation you definitely want to have with a vet, because it can be a high cost, and then if you don't manage well, then you haven't eradicated it from your flock, and it's a bit wasteful and not good antibiotic stewardship. So if you're just trying to treat individual cases, there's other options, and you can do that yourself as well, as long as you discuss like what's a case and when should we treat it with your vet.
Right. And it's so, an interesting thing is sometimes you talk with small sheep farms, that's because we're specializing in that, but we speak with people about that, and, you ask if they have a vet, and they kind of use a variety of vets. They call different people for different things. And to me, it seems like it's a good thing to establish some sort of a relationship with your vet. So the vet knows you too. Like, she's not going to call me unless this is something that I really need to be on board with. Or what do you think about that versus just kind of that approach of when you need somebody, find somebody?
Yeah, I think it's really tricky to have a bunch of different people, especially if some of those people are like online forums, because you can get a lot of outdated information or just really incorrect information. As far as we're concerned, any farm should have a vet of record, and they're welcome to consult other vets, but the other vets need to know that they're deferring to the vet of record, because that vet is ultimately responsible for any antibiotic use and residues you have. So as long as maybe you pick your main vet, and if you want to consult about something like milk quality or something a little more specialized with someone else, that's great, but keep your main vet in the loop about who that is and what you're learning and what you're doing.
Would you think it would be important? I try to have my vet come out once a year, and there's the antibiotic, things on that, but also just for flock maintenance, just letting my vet lay eyes on my flock. Is that something that's something you would recommend for people to do? Have your vet come out if there's not any problems? Yeah,
absolutely. If that's something you can do, and different vets and different states have different laws about what that means, but to have a vet patient relationship, they should at least see the premises, see what your environmental risks are, kind of where the animals are. And then if and when you ever have an emergency, it's just so much better if we've been there and we know where things are we going to have access to water, to hot water, to what are things that you're experienced with that we can talk you through versus what we really just need to come out and do. So to make it worth your while, definitely prepare questions and prepare things. But I think physically being on the farm once a year is a great idea.
Okay. The other thing I wanted to ask is some of the misconceptions or errors people make in caring for small ruminants. So, something that might be out there as an idea, but you would say don't do it.
Yes, we hear those all the time, often around deworming and parasites. For a long time, it was said, and it was correct, that you should routinely deworm, but we have done so much of that we've worked ourselves into a bit of a hole as far as resistance, and the Northeast is actually kind of the last holdout where we have less resistance issues than the rest of the country. So we can still maybe get by with just a single dewormer, sometimes two, but most of the country require 3 different drugs if you actually want to take care of the homunculus parasite. So that's a big misconception that people just keep making worse as they treat with a single dose that's not high enough. That's a really big issue. Treating with a drug that we know doesn't work in this area or on that parasite. Definitely working around parasites. I've also seen people brand new to their sheep and goats that are really excited about how much grain their male goats are eating when they're babies, and that can be so dangerous because they develop urine stones from the kidneys or the bladder, and that is absolutely deadly. We can try a few tricks in your older animals to pass a stone, but if that doesn't work, we euthanize, or we can submit to somewhere like Cornell or Tufts for probably more than a week of hospitalization, and even those are maybe, there's no guarantee that they can get them better. So definitely talking to someone who knows more about nutrition, which is one of my main topics whenever I talk to a new owner, but growing animals and lactating animals can use some grain, but beyond that we want to stick with a hay diet.
So I think this kind of leads into a general recommendation for, I'm I'm going to be starting a farm and I want to start with sheep or I want to start with goats, or what would you suggest a regimen? Or even just, I know when I got started, the woman that I was lucky enough to have bought the sheep, all from one person, and she said to me, cleanest water, just hay, grass, just stick to the basics.
Oh, the basics, I know.
Yeah, stick to the basics.
Keeping them clean and dry. It sounds easy, but that's going to keep everything. Right, exactly. That's going to prevent so many problems. Definitely clean water. I think people overlook that a lot. But water's one of the limiting factors of feed intake and just health in general. So the big things I talk to people about are, let's see, parasites, which we kind of went over.
Right.
Only deworming when it's necessary, fecals, etc. Nutrition, so grass, hay, avoiding things like alfalfa and a lot of grain, but also how to body condition score your animals. There's lots of good online charts and graphs that you can probably be safe with using those. Especially with sheep, with wool, you have to put your hands on them. You can't just look. And I think a lot of people towards the end of summer think they were doing great out on pasture. They're super woolly and fat. And when you put hands on them, they're actually quite skinny. Let's see, hoof trimming and vaccinations are things that we're very happy to do, but also a lot of owners can do them themselves. Hoof trimming is not like in a cow where they have very hard hooves. They're very soft. You can get great hoof trimmers and maintain hooves. I like to have people look at them at least every 6 months. They may or may not need to be trimmed, but usually at least every year they do.
Can you tell us what that, if I'm going to be looking at it, what am I going to be looking for that says, I should trim my hoofs?
Yeah, so the goat and sheep hoof kind of grows under in a almost covering up the bottom part, and we don't want that to be what they're walking on. It leaves a really kind of moist, dirty environment underneath. So we want the wall of the hoof to be kind of flush with the ground all the way around. We've got a good image in our little booklet, but it's one of those things where you should probably learn from somebody the first couple times, and then after that you can probably take care of it yourself. But if you're trying to learn from your vet, let them know. Maybe they can let you get in there and see you do 1 foot, and then you can do the other 3, and just make sure you've got it figured out. Because you can go too far. You don't want to trim the toe far too back. You can cause little abscesses to form. And you never want to trim any of the soft actual foot tissue. We're just talking about the hoof growth.
I know that Dave Martin, who is the head of Sheep and Goat, and he talked a lot about eyes on flock. And I've always felt that was something that was an important thing, whether you had a huge flock or a small flock, or knowing what's normal for all of your animals, right? Would you say that that's like an important part of caring for your animals, seeing them enough and being with them enough to know that this is not normal behavior for this particular animal, and it might be for the other?
Yeah, I think if you have a small enough flock, you can know they're individually like that, but also as a flock, if they're acting differently. Sheep love to hide things until the very last moment when they're really, really sick. So sometimes, especially when I get there, an owner will say, like, this is not normal, there's something going on. But for me, that sheep is presenting itself as totally healthy because I'm a predator and they don't want me to see their weakness. So I really need to know that, and any subtle things you're noticing that's different, so that I can hopefully find what's wrong. We always believe you, even if we're like, I don't know, it looks normal to me, but it's just because that's how they behave.
Right. And so when I'm getting ready for you to come to my farm, what kind of things should I prepare for, and how best can I serve you? So, I think about how to get ready. When we sat down with Mary Lake as a shearer, and we talked about, what do you want us to do when you come to our farm? So when you're coming to my farm and I've called you, what do you want me to have ready for you? How do you want my farm to be presented?
It's a great question. Basically, let's see. If we're there for like a routine annual, we're going to do vaccines. The vet will have to do the rabies, so at least with that. And if you want, like, you got, some here and some over here, they're all in different places. Let's try to we'll see what the vet wants, but get everything done on everyone as we go, so we're not running around all the different pens a bunch of different times. If you don't have water handy in the barn, having a bucket of it for us would be great. So we always clean up afterwards.
Do you want the animals, for example, like sheep, even if you have them in a penned-in area, nobody wants to chase them around because nobody moves faster than my old you.
Right.
And so you don't want to chase them, so should we have them, kind of contained for you?
If it's one individual that we're looking at, that'd be great. Yeah, if it's the whole flock, I guess whatever best handling method you can think of. Some people have little chutes or at least little runs. You can run them through. A good way to mark if we're like processing everyone, vaccinating everyone, that we can spray paint or mark them somehow that they're done. If you want fecals done, we can take the poop, but if you want to prepare that ahead of time in little baggies and have fresh fecal samples from all of your animals that need that done. So that might not be everyone, especially if you've got a good sized flock, but anyone who's skinny, anyone who seems pale, which is another thing that you should learn by doing, but once you figure it out, you can look at eye color and find out if anyone's anemic. We want to have those fecal samples, and so if you just have those ready, fresh, refrigerated, saves a bunch of time on our end, and vets usually charge by time, so we're happy to do those things, but you are also very welcome to do them.
And encouraged.
Sure, do that yourself. But, whatever works best for you that way. Yeah.
And then a snack for you.
Oh, for me?
Yeah.
That rarely happens. That sounds great.
Note to everyone.
Yes.
So on the flip side, what are some things that you don't want me to do? You don't want to get out of your truck and have my dog attack you.
Oh, that's a good example.
Seriously.
No dogs. That's a tricky one, I think.
Is there anything that people do a lot and you kind of go, when you get there? And
not very much, to be honest. I'm sure I'll know it when I see it.
The dog thing, though.
The dog thing, though, usually dogs are very welcome, and we are happy to see them. But something that I really don't want people to do. No, I mean, it's always great to ask, like, is this helpful or whatever, but just be yourself. I guess it's good to get to know everyone as who they are too. So
that's nice.
Yeah.
And so, on a personal note, what's your favorite animal?
I would have to say the cow, the dairy cow. Much as I like sheep and goats as well, and it is a fun change of pace to work with people, not only with backyard pets, companion animals, which we see a lot of, but here in Vermont it seems like there's a lot of production sheep and goat farming. If it's wool or milk or meat or grazing under solar panels, so many cool things that they can do for us. They're very cool. But I grew up with cows. I really love cows.
Did you were in 4-H? Is that
4-H and FFA?
Yeah. And you had a special project, right? What was didn't you have a cool project in 4-H or something?
Well, I raised heifers myself. I had a kind of like a boarding business for other dairy farmers that I took their heifers and dry cows and raised them, especially towards the end of high school when buying a calf and raising it to calving is a 2-year commitment, and I had to kind of transition out of having a lot of animals, so I boarded them.
But the cow is I
would say so.
Yeah.
Sorry to all you shepherds.
It's okay, let it go. And so then also, because I see that you have a new cat.
I have a cat. Dog,
yep. But they don't rate. They're not big enough.
Oh, no. I've actually got 2 dogs, and one of them is quite large.
Yeah.
Not quite a large animal.
Cow size.
No.
Do you have cows of your own?
I don't. We had some borrowed sheep last year to take care of our pasture and eat it down, which was great, but then they got out, and it was a problem. We hope to have some beef cows. We have a couple acres fenced in and a barn, so we hope to do that. But hay this year has been really difficult. Sure. We didn't want to try to get in on it when that was a problem, and we had a baby born about 8 months ago. So we've been busy.
We have been busy. You don't need a cow on top of that. That's right. And then the most difficult task as a vet, and I'm sure that that's completely individual, and that's why I'm asking, because I think of all kinds of things, but I'm sure there's things that you come up with that I wouldn't even think of.
Oh yeah. Well, the most technically difficult we love, and whatever that is, if that's a really difficult diagnosis or something, that's hard to describe. But I think the thing that I least enjoy, because it's so difficult, is when you find an animal and I know in my head that it probably needs to be euthanized and the owner isn't there yet in their head or has no idea. It's the soft skills, I suppose, but getting somebody to that point, to understanding when it's just the nicest thing to do, that we just need to put them down because we can't help them anymore, which that's really tough.
Right. How about fly strike?
Fly strikes, pretty bad, but they respond great to treatment, so that's not a terrible one.
That's the only time I've ever seen my vet gag.
That's a good one. Yep. But simple clipping and cleaning and dewormer. Oh man.
Yep. And how about the most joyful? The calving? Definitely the births. Yeah, lambings, kiddings, and calvings. Yeah, they're wonderful. So much fun. Especially really lambings and kiddings, I would say, might be my favorite because they're not as physically exhausting, and you get a bunch of little babies usually. Some C-section, small ruminant C-sections, super fun. And how about calving and lambing? And do you feel like most of the time are people pretty good about letting you know if you need to come in, or is that something that people try to take on more than they should when they're doing that? That's all over the board. It's very individual. Some people tried probably for too long, and that's something that, like, back to training the Hispanic workers, you can set parameters, but each case is individual, and so I can only kind of give guidelines so far. It's really up to your comfort zone, but also we say don't try the same thing for more than 15 minutes without making progress, without seeing results. Sometimes it's hard in the moment to keep track of time, so we even tell people to set a timer. Say, all right, if I haven't made progress in 15 minutes, I need to try something else, and if I don't have the next step in mind in my toolbox, then you have to call help. And at that point, really, when you call, it's great to give the mom a break and just kind of let her hang out, give her some water, and don't keep trying if the vet's on the way. Yeah. That's really good advice. Yeah. And how about some tips? We talked a little bit about what to do on your farm, but how about some tips about purchasing new animals that are coming onto your farm? Right. So if someone is bringing some new animals new sheep into their flock, new cows into their flock, setting up the new space, anything that you can think of that helps make that adjustment a little bit easier for animals? Yeah, so quarantine is really important, especially if you've got a flock that you know to be free of a lot of parasites or other diseases. Anyone new, you want to, ideally, if you can do testing beforehand, before they even get to you, make sure everything is negative. Diseases that we think of are like CAE in goats, OPP in sheep, CL and Yonis, that any vet can walk you through the biosecurity screening we do, and then a fecal for parasites, because if your animals are well managed and you make sure that your parasites are susceptible to any dewormer you use by managing, then you don't want to bring in animals that have been exposed to all these 3 dewormers we have and have resistant bugs. So make sure you know about their parasite load and history of deworming. And then in quarantine, we kind of want that to be about 2 weeks. And sheep and goats don't like being alone for 2 weeks, so try to buy more than one at a time if you're going to bring them in specially like that. So at least they have a buddy to hang out with. Okay. That's really good advice, too. So thank you so much for speaking with us this afternoon. So we've been speaking with Elizabeth Martens from Valleywide Vet in Bridport, Vermont, and we really appreciate you taking time to do this, and we've learned a lot of really important things today. So great. Well, thanks for doing this.